Hello and welcome to Building a Movement for Health Equity. My name is Erica Burrows-Girardi and I am a community coach with County Health Rankings and Roadmaps. The County Health Rankings and Roadmaps program is based at the University of Wisconsin Population Health Institute and is a collaboration with the Robert Wood Johnson Foundation. I'd also like to acknowledge that this program is the result of the contributions of many colleagues and partners in Wisconsin and across the nation. Thanks to their support, we're able to bring you this webinar today. Again, my name is Erica, and I would like to welcome my colleague, Justin Rivas. Justin, thank you for joining me on this webinar.
Hi, everyone. Thanks for joining us here.
And I also want to briefly introduce you to today's guest, Jonathan Heller with Human Impact Partners and Leah Stevenson with Public Health Madison and Dane County.
Thanks so much, Erica. Thanks for inviting us to be part of this, and thanks to everyone who's listening today.
Yeah, I'm excited to be here.
Good. We'll hear more from Jonathan and Aaliyah later. And right now, I'd like to ask Justin to share a little bit more information about how you can engage with us throughout the webinar.
Hi again, everyone. I want to take a moment to get you used to the Zoom webinar attendee interface. So let's start with submitting questions. If you want to submit a question to any of the panelists, simply click on the Q&A control. And when you do, the Q&A box will open up. Just simply type in your question here, and then click Send to submit your question. And you can send in your questions at any time throughout today's live webinar. And next, I want to tell you about the chat feature, which is similar. You can use chat to make comments or respond to questions that we may ask of you, the audience, during the webinar. And to use this chat feature, just click on the chat control. When you do, the chat box will open up, and then simply type in your comment, and then press Enter to submit your response. And remember that the chat is used to make comments or respond to questions we may pose to you, but use the Q&A function to ask your questions of us.
Thanks, Justin. And we'll definitely be doing a poll in a little while, and then we're also going to pose a question to you so you can actually take advantage of that chat feature. Again, like Justin said, you can use the Q&A box at any time to send us questions and use the chat feature to make comments or respond to those questions that we may ask you to respond to in the chat box. So let me set the stage by sharing what we will dig into today. Some of you may be new to County Health Rankings and Roadmaps, so I'll spend a few minutes letting you get to know us a little bit better, and then I'll share some resources that can help you advance health equity. Then we'll hear from our guests, Jonathan and Aaliyah. We'll definitely leave time for your questions before we close. I want to start with defining health equity. Health equity is the notion that everyone has a fair and just opportunity to be healthy. Now notice that achieving health equity requires action. We must remove obstacles to health such as poverty and discrimination, and we must create access to good jobs with fair pay, quality education and housing, safe environments, and quality healthcare for everyone. If you want health outcomes to improve, taking steps to advance health equity has to be fundamental to your work. So why is health equity important or so important to us at County Health Rankings and Roadmaps? Have you ever noticed our tagline in our logo? We seek to build a culture of health county by county. And to do this, County Health Rankings and Roadmaps support communities in a number of ways. We provide data to guide decision-making. We offer evidence of policies, programs, and strategies that work. We offer guidance to communities by connecting you with opportunities to learn from others. In fact, today's webinar is one way in which we're allowing you to be able to hear from others and learn how they're actually working to create health equity. And then lastly, we provide practical tools to help you move forward. All of these activities advance health equity, which ultimately leads to improved health outcomes. Our rankings model also helps explain why health equity is so important. It shows the relationship between policy and programs, health factors, and health outcomes. It shows us that all of these factors impact how well and how long we live. So I'm going to tease out the model a little bit and show you what it tells us. Starting from the bottom, we know from research that effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. Many health factors, those in the blue boxes, shape our community's health outcomes. And we specifically look at 4 buckets of health factors: health behaviors, clinical care, social and economic factors, and the physical environment. And we measure 2 types of health outcomes, those in the green boxes, to show how healthy each county is by length of life and quality of life. So if you're wondering how this translates into real life, I want to give you an example so you can see what I mean by this. Expanding early childhood education improves academic achievement, and this results in higher graduation rates. Well, higher levels of education lead to higher levels of income, which make it easier to access healthy foods, clinical care, and quality housing, all of which in turn influences health outcomes. Again, notice that policy is at the foundation of the model. This means that in order for everyone to have a fair and just opportunity to be healthy, we must redress policies that have caused health inequities. But I do realize that this is easier said than done. Building a movement for health equity does require thoughtful and intentional planning. So I'm really glad that you are on the webinar today. This is a good way to start. So at this point, I do want to hear from you. We're curious about where you feel you need the most support in building a health equity movement. So I'm going to ask Justin to launch a brief poll, and please share where you feel you need the most support, and feel free to check all that applies. Do you need data to help guide decision making? How about evidence? Do you need examples of policies or programs or strategies that we know work? What about guidance? Would having examples from other communities be helpful? And lastly, would having practical tools to support you be helpful? So again, please take a moment to respond, and remember you can check all that apply. And I do know we have quite a few people on today's webinar, Justin, so I'm going to ask you to give a moment to allow folks to respond.
Sure thing, Erica. There are quite a few folks today, and a pretty great response rate already. So about 65% of you have voted. So we can just wait a few more seconds here and see if we can take that up just a bit.
Thanks.
Sure. So at about 70%, and so far it seems like a majority of you, about 3/4 of you, have voted for, brought the poll in at the examples of policies, programs, or strategies that we know that work. Mm-hmm. And about 61% of you are looking at examples from other communities. And then about 47% have responded to the data to help guide decision making.
Okay, great. Thanks for sharing that, Justin. So I want to share a few county health rankings and roadmaps resources to help you get started building your movement for health equity. We talked about data in that poll. So as a rule of thumb, always start with the data and go where the data leads you. Within each state across the country, there are significant differences in health outcomes according to where people live, learn, work, and play. It's clear that not all Americans have the means and opportunity to be their healthiest. And so that's why we've created the Health Gaps Report for every state. In these reports, we focus on the gaps and opportunities for health that exist between counties within each state, and then we provide strategies to address factors that influence these differences. We have even included a discussion guide that you can use to engage your community and stakeholders in a discussion about these gaps and how you can all be part of the solution. So check out your state's report and plan a community discussion around it. I think that's a great place to start in terms of building your movement for health equity. Now, within 24 hours, we're going to have a recording of this webinar posted on our website, and along with that, will be a list of resources that you can use to get started. And included in that list will be the link for the Health Gaps Report and the discussion guide. So next, look for evidence of what works. Our What Works for Health tool can help you find policies and programs that are a good fit for your community's priorities. Each strategy is given an evidence rating to help you decide what's appropriate. And they are all given a disparities rating as well, so you'll know whether or not the strategy is likely to have an impact on disparities. A link to our What Works for Health tool will be included in the list of health equity resources that we will post along with the recording of the webinar. And if you're looking for guiding examples of how others across the nation have begun building a movement for health equity, check out these 3 webinars already posted to our website featuring Jefferson County, Alabama, Bronx, New York, and the Monadnock region of New Hampshire. And continue to tune into our monthly webinars, as we will be focusing on health equity strategies in future webinars as well. We'll be sure to include the link to these webinars on that resource sheet that I'm telling you about. And then we encourage you to check out our community highlights on our website, featuring communities just like yours working together to advance health equity locally. You can filter your search by state, health factors, or even strategies. And now we're going to hear about a practical tool that you can use to help you begin building your movement. So I want to welcome Jonathan Heller, again, a co-director and co-founder of Human Impact Partners. Under Jonathan's leadership, Human Impact Partners has become a national leader on research, advocacy, and capacity building, focused on changing policies related to the social determinants of health with a strong reputation for its commitment to equity and community empowerment. Among the numerous other things that Jonathan does, he provides training and technical assistance on health impact assessment and health in all policies, and supports public health departments to develop leadership and capacity to advance health equity. And today, Jonathan's going to share more information about the Health Equity Guide, which is a tool that you can use to build a health equity movement. Jonathan, you know I'm a huge fan of the Health Equity Guide, and I just had to have you on as our guest to share this great resource with our audience. So thank you so much for joining us today.
Thank you again, Erica. It's great to be here.
Yeah, so can you start by telling us a little bit about Human Impact Partners and where the idea for developing the Health Equity Guide website came from?
Sure. So Human Impact Partners is a national nonprofit. We're based in Oakland, California, and our mission is to transform the policies and places people need to live healthy lives by increasing the consideration of health and equity in decision making. We do that through research and advocacy and capacity building, and we focus our work on bringing the power of public health to social justice campaigns and movements.
Great.
The Health Equity Guide grew out of our capacity building work with local health departments. With the support of the California Endowment, we looked at what health equity thought leaders like Tony Eiton, Richard Hofrichter, Jean Ayers, and others have written about what local health departments can do to advance equity. From that, we compiled a set of strategic practices and a theory of change that health departments need to use if they want to make meaningful progress on equity. Then those strategic practices and the theory of change became the basis for the website. We then worked with about 20 advisors to create the healthequityguide.org website that we hope is a useful resource to folks on the phone and others.
Yeah. Okay, so tell me a little bit more about that theory of change that underlies the guide.
Sure. So you started describing a little bit of this earlier, Erica. Health inequities result from inequities in the social determinants of health, like housing and employment conditions. Those inequities in the social determinants of health exist because there's an unequal distribution of power in our society. Those in power benefit from the inequities in the status quo, and they push back against policy change that would address inequities because those changes often would hurt them in usually financial ways. So you can think about a real estate developer who might not make as much profit if they have to build more affordable housing. That real estate developer might have relationships with elected officials because they've made campaign contributions to those elected officials. That real estate developer has power. Those facing inequities, on the other hand, usually have experienced decades or centuries of disenfranchisement and a lack of power relative to those who control our institutions. Those who have power also use forms of oppression like racism to maintain their power. And so all of that, to us at least, means that in order to address equity in a lasting way, we in public health need to address power imbalances and to confront oppression directly. And if we do that, if we make our systems and institutions accountable to all people, we'll see equity in the social determinants of health and then health equity.
Yeah. So you just covered a lot, and I want to dive into a little bit about what you said. Let's kind of dig in a little bit with this power thing, because that's not a concept we talk a lot about in public health. So can you just share a little bit more about that?
Yeah, that's right. We don't talk a lot about it, and we need to get more comfortable with it.
Yeah.
So we define power as the potential to shape our lives and the world around us. And Dr. Martin Luther King said that power is the ability to achieve a purpose. Whether or not it is good or bad depends upon the purpose. So we think it's important for us to use power in a good way, and we think that advancing equity is a good purpose. And so that aligns with the good in the world. Power can manifest in different ways. Power can mean influencing a decision, like a city council vote. How can health departments help influence policy decisions that advance equity? And we often in public health departments use data to do that. It also means that we need to influence what's on the political agenda. Gun control is not on the political agenda because the NRA is powerful. Another policy that has not been on the agenda for years since Nixon was president is the guaranteed minimum income. We have to think about who's keeping that off of the agenda. How can we, in public health, influence what is on the agenda, which is just as important as particular votes. And we think we can do that by building powerful coalitions across sectors and across movements. And last, and perhaps most important, another form of power is influencing people's worldview and their, the dominant public narratives. In the US today, we believe that people should be pulling themselves up by their own bootstraps, that government should be small, and that the free market has all the answers we need. Folks think that health is really about individual behaviors or genetics. We need to change all of that if we're really going to make progress on equity. We need people to deeply understand that social, economic, and environmental conditions that we actually have control over lead to those health outcomes, so we can actually control health outcomes. That's a very different narrative. So all of this power stuff is very different for public health.
And something else that's different is race. I mean, that's, I've been involved in public health now for over 20 years, and race has not been a topic that I've had to discuss a lot about in terms of being able to create a healthy community. And so I think that's another topic where we see some discomfort for those of us involved in public health. So tell me about this need to focus on racism. Could you share a little bit more about that, and particularly why folks in primarily white areas should also be focusing on racism?
Yeah. We get that question a lot. So we have three main answers. There are other reasons as well, but the three reasons we would give are that first, because across health, across housing, education, criminal justice, employment, almost every other institution and system you can think of, and in every jurisdiction and pretty much at every geographic scale, people of color in the US are doing less well. Racism is baked into the creation and the ongoing policies of our government and our media and our other institutions. Second, racial inequities are found within all other dimensions of identity. So whether you think about income or gender or sexual orientation, racism plays a role in all of those as well. We need to understand race even when we're looking at inequities by income. We need to take this intersectional approach. And then third, and from a very, very practical point of view, it's because racism is used as a political tool by those in power to maintain their power. Many people are starting to call this strategic racism. That's a term I really like. We're not going to win if we don't address racism. Until we build bridges across communities that are facing inequities and that have been disenfranchised, we're not going to make the progress that we want. So if you're looking at a primarily white jurisdiction, those folks, people working in those jurisdictions need to understand and need to work with others to understand how racism has been used politically to keep folks facing inequities divided. You need to actively be working to build bridges between your white community and communities of color. That's how we can build power.
Right, exactly. So you and I have a mutual friend, Greg Townsend, and he told us that the Jefferson County Department of Health in Alabama has adopted what's called an inside-outside strategy. And I know you talk about that in the Health Equity Guide, so I'm going to ask you about this in a second. But he said that they developed an inside-outside strategy and in order to be able to begin their movement for health equity. So tell us what you mean by this strategy and how it helps.
Sure. So this again goes back to this idea about the need to focus on power. And so how do we in local public health departments and public health more generally focus on power? We would put forward that a health agency by itself is never going to have enough power to advance equity. Political forces favoring the status quo that I talked a little bit about before are going to slap down any agency that acts alone. So health agencies do need to get their own houses in order. We do need to build our own capacity to address inequity through training, through changing our internal processes and policies, through using data in different ways. And that's the inside track. And that's very important, but we also know that that won't be enough. We also need to work with other government agencies like housing or transportation, who are often making decisions that impact health equity. And most importantly, we think people who are directly impacted by inequities need to be involved in our work. And a great way to do that is by partnering with community organizing groups. Those community organizing groups work with communities on social determinants of health, though they never call them that. We need to adopt their language and think about it from their perspective. Those community organizing groups also have a clear focus on building their power, the power of the people that they represent who are facing inequities. Right. So importantly, one other thing that they can do is that if they've got the community at our back, if we as a public health agency do something that's risky, they're going to be able to protect us. So community organizers bring all sorts of stuff to our work. And then this outside component, just to summarize, is working with other agencies and with community organizing groups.
Yeah. County health rankings and roadmaps are, we always tell communities that we help, that you have to work with other people. You have to get outside of the public health bubble because public health is not responsible for creating health in itself. So you're absolutely right about that. So that's part of that inside and outside strategy. And if you, to our audience, if you want to hear more information about how the Jefferson County Department of Health used this strategy to begin building their movement for health equity, check out the webinar that was on that list. It's called Advancing Health Equity Through Strategic Partnerships. And again, we're going to be sharing that link with you all on our resource sheet. But they definitely use that strategy to begin to move forward with health equity. But Jonathan, with all this in mind, could you share your screen and actually take us through the guide briefly? It would be great if you could highlight when you do that, those strategic practices that you were talking about and about the inside-outside approach. But, of course, you can share other parts of the website as well. So.
Yeah, absolutely. All right, so here it is, healthequityguide.org. I'm assuming everybody can see that. Erica, I assume you can see it?
I am going to, can you share your other screen perhaps?
Uh-oh.
Because I am, Justin, are you able
I
to
see it. I see it.
Okay,
okay,
right. So we're good.
Great.
All right.
All right, good. That's good to hear. You scared me for a second.
I know.
Okay.
Sorry.
All right, so here's the homepage, and you can see, you can jump quickly to the strategic practices that I'll be talking about at the top. You can see more about our webinars, case studies that I'll talk about in a second, and information about some of the that I just covered around why we're doing it this way, why we're talking about power and our theory of change. And then here up at the top, you can also see quick links to all of those places. So if you look at the strategic practices, we have put them into 4 different categories that should sound familiar based on what I just said. So there's building internal infrastructure in the first column, working across government, fostering community partnerships, and then a column that transcends all of these of we need people to be championing transformative change as well. So just for example, you can under the building internal infrastructure. There's mobilizing data and research. When we work across government, we need to build powerful government alliances. We need to share power with communities, and we need to confront the root causes of health inequities like power and racism. So you can click on any of these and you come to a page that describes that particular strategic practice. In this case, it's mobilizing data, research, and evaluation to make the case for, assess, and inform interventions for health equity. So at the top of this, we describe what this means, what we mean by this practice. You can link to case studies that demonstrate how a local health department has actually used the practice. And then we have suggestions for actions you can take to get started on that strategic practice. And then down at the bottom, we have a link to related resources that you can dive into to learn more about that.
Gotcha.
So we have one of these for each of the strategic practices. And then we also have 26 case studies. So I clicked on one of them. This is Boston uses public housing to promote healthy birth outcomes. And so for each of these strategic practices, we went into a lot of detail that we heard that people wanted a lot of detail. So we have an overview of the case study. We have some background on what led to the work. We have a description of the program. We have outcomes and impacts, future work that they might do, informal advice from the people who we talked to about this case study, and then cross-linking back to the strategic practices again. So lots of information on here, maybe more than everybody can handle at once, but we think people will come back to this repeatedly. There are a ton of resources, over 150 resources on the resource page that you can kind of dive into by strategic practice. So just clicking on one, you can just see a whole bunch of things. County Health Rankings is in here as well, right in the middle there. Yeah, no problem, of course. You guys do great work. And the last thing I'll share is the downloads page, where you can find PDFs that summarize different parts of the website. You can also find archives of webinars that we've done. So far, we've done 3 webinars highlighting the first 3 buckets of strategic practices. This webinar that we're doing currently will go onto this page as well. And just so folks know, we have one more, our last in the series of 4 webinars coming up that will be on February 15th, and it's on this Championing Transformative Change bucket. And so you can sign up for that on our website as well.
Great.
So that's the website, Erica.
Thank you. It's, this is a really rich website. And so I do want to encourage our viewers to make sure that they take some time to kind of dive into it. Not right now, but definitely later to do that. But thank you for just kind of giving us like that quick overview. Last question for you, Jonathan. Could you say a bit more about how you think local health departments and others can use the Health Equity Guide? It's clearly not a step-by-step guide, but I know that, and we often talk about how health departments need to get out of the 4 walls and work with others that are not in the public health sectors per se. So how can the guide help with that?
Sure, yeah. So let me just start by saying you're right. This is not a step-by-step approach. We recognize that everyone is working in a different context. They have different opportunities and challenges. They're at a different point in their health equity work. And so we've built this so that there are multiple entry points. The strategic practices in all 4 of the categories are interconnected and synergistic. So, if you want to be building government alliances, you may actually need to start by doing some data work, which we have put into the building internal infrastructure category. So we don't offer a cookie cutter approach, but rather we offer a range of strategic practices. So, generally we think that folks can just dive in by selecting 1 or 2 of these strategic practices that make sense to you at your point in your work and start moving those forward. But that said, here are 3 kind of, I think, practical suggestions for how you can get started. First, you can go through a process with your coworkers to assess where you're at with all 15 of the practices, and then decide on which are the ones you want to move forward on. You can take some steps on those, evaluate your progress, and then decide what to do next and go back in again. A second thing, and this is probably the most important thing you can start doing, places the health departments haven't been doing a lot, is you can start forming relationships with community organizing groups in your communities. You can find out who they are and what they're working on, reach out, meet with them one-on-one, talk about your shared values, talk about overlapping interests, start building trusting relationships. Those are going to be your key allies. And then third, find equity allies in other branches of government. Who are the equity-minded folks in your housing department or your transportation department? Start building those relationships as well.
Right. Right. Building relationships. Oh my goodness. I can't tell you how many times we tell folks that's just like the centerpiece. That's a hallmark of getting things started, is taking that time to build those trusting relationships. Jonathan, thank you so much. Now stick around because we got questions and answers, and I'm sure we got some questions rolling in from our audience. So I do want you to stick around to participate in that. And
Will do.
thank you so much. So again, I want to hear from you. And this time, Justin and I are going to ask you to share with us how you are building a health equity movement in your organization or in your community. And we're going to ask you to use the chat box to do that. And you can just make sure you use the drop-down box to chat to the panelists and attendees. That way we all can see your response. And then in a few minutes, I'll ask Justin to share some of your thoughts and reflections. So, and now for an example of how a health department is using the guide to begin building a health equity movement using that inside-outside strategy, I want to welcome again Leah Stevenson. Leah has a lifelong commitment to equity, challenging systems that perpetuate inequities, and a real understanding of culturally diverse communities through personal experience as a woman of color. She is a public health supervisor in the Policy Planning and Evaluation Division at Public Health Madison and Dane County. Our primary responsibility in this role is to provide oversight of the work of effective and sustainable community outreach and collaboration, guiding these efforts using a health and racial equity framework to support policy, environmental, and system change. Leah is also a 2017-2018 Human Impact Partner Health Equity Awakened Fellow. So welcome, Leah.
Thank you, Erica. Glad to be here to talk about the work we're doing at Public Health Madison-Dane County.
Awesome. So could you start by describing your health department and just the community that you serve and where health equity sits within the structure of your health department?
Absolutely. So Public Health Madison and Dane County is situated in Madison, Wisconsin. We are a combined city-county public health office that serves a population of over 520,000 people. Almost half of these people live in Madison. We have approximately 140 staff within 4 divisions: environmental health, community health, operations, and policy planning and evaluation. Our health equity work sits within our operations division. However, our health and racial equity work is led through an agency-wide team that represents all divisions. And you see the first year of that team right there on the screen.
Great. Good. And you guys look so good. So considering the 4 groups or strategic practices that Jonathan was telling us about that's in the health equity guide, where would you say that you all have made the most gains?
Yeah, I would say that we are working in a number of the strategic practice areas. However, I believe our greatest gains have been with building organizational capacity.
And what have you done in that area?
Well, internally, over the past 2 years, we have really ramped up our health and racial equity work, primarily through the creation of our health and racial equity team. Our health and racial equity team began with 15 people, as you see above, from across the agency and has now grown to 30 people who have been or who are currently part of that team. Our goal is that eventually every person within the agency will have the opportunity to take part on the health and racial equity team. And this team has really sparked a movement throughout the agency that has resulted in an organizational culture shift.
I bet that culture shift is probably really, really important. I would love for you to tell me what that shift looks like or feels like now that that has happened or starting to happen.
Yeah, I think first we are doing work differently now. For example, in our strategic plan, we have committed to strengthening public health Madison-Dane County to improve the health of our community by committing to equity, inclusion, and anti-racism in our work. And we have systemized that commitment throughout the work of the HRE team, that's short for Health and Racial Equity Team, in doing things like creating mandatory equity warm-ups for agency-wide monthly team meetings, mandatory racial equity and social justice trainings for all staff, embedding health and racial equity within performance evaluations, evaluating our progress biannually through a robust organizational assessment, and using racial equity tools to examine our policies and procedures. I would also say we're starting to look different. Our staff are starting to slowly look more like the community we serve in terms of diversity. And a third thing I would say is that we're beginning to sound different. Our conversations around race are becoming more regular and robust. And if I can borrow from the Government Alliance for Race and Equity, or GARE's, theory of change, our health and racial equity work has been normalized, organized, and is now beginning to be operationalized at greater levels throughout our agency.
Yeah, I love that. It kind of reminds me of what I was talking with Jonathan earlier about being comfortable talking about race and racism. I think you're probably starting to see that shift within your health department. So thanks for that honest reflection. So how are you guys, given everything that you said, how are you actually using the guide?
Well, I would have to say we're probably discovering a new way daily to use the guide, but we are using the guide to both inform our inside and our outside strategy. Within our inside strategy, the Health Equity Guide is informing our health and racial equity team's planning and integration of health and racial equity work throughout our agency. So annually, the HRE team meets to identify action items for the following year. And this year, the Health and Racial Equity team is reviewing the Health Equity Guide through its assessment and evaluation work group. We'll be using the Health Equity Guide to craft more detailed action items. We are using the best practice examples that Jonathan showed us within the Health Equity Guide to provide some concrete ideas for what we can do within these different strategic practice areas. We have also reviewed some of the case studies that Jonathan showed us to provide further context on how to incorporate these strategic practices into our health department's work.
Great. Yeah, community examples are really, really important. We saw that in the poll earlier when people were responding to wanting to have those community examples. So make sure that you all take a look at that within the Health Equity Guide. When you and I met a few weeks earlier, you told me that there were other areas in the health department that were using the guide as well. So where have you seen the Health Equity Guide be really helpful for other departments?
Yeah, so thanks for saying that. So outside of the Health and Racial Equity team, we're also using the Health Equity Guide to take an intentional pause to examine and improve how health and racial equity work is being integrated into the department as a whole. Again, using the strategic areas to brainstorm recommendations. For example, in the strategic area number 1, building internal infrastructure, one of the recommendations was develop and use equity analysis tools during the budget process, specifically to focus on program budgets, to identify benefits, burdens, and impacts on health and racial equity, and incorporate participatory budgeting strategies to give voice to staff and community partners. Another example, in the strategic area number 2, working across government, we recommended and really thinking about how can we assume the role of chief health strategist, embedding health and racial equity principles throughout the CHA chip and working with local health systems.
Okay, that's so cool. And for those of you who are not familiar with CHA chip, CHA is the community health assessments with communities are charged to do, as well as the CHIP, which is the community health improvement plan that health departments are often managing for their community. So Leah, I see here on your slide that your accreditation processes are benefiting from the Health Equity Guide. How's that working?
Yeah, this is new and exciting. As demonstrated on the slide that everybody's seeing, we are beginning to figure out how we can embed health and racial equity principles into agency operations, including accreditation. Mm-hmm. So we have developed a crosswalk tool that seems to grow and change daily that aligns the accreditation standards within the 12 domains outlined by the Public Health Accreditation Board, or FAB, mm-hmm. With the strategic practices outlined in HIP's Equity Guide, Health Equity Guide. We decided to take this approach because of the importance of incorporating advancing health and racial equity into all the work we do here at Public Health Madison-Dane County. And through this crosswalk tool that aligns accreditation and the Health Equity Guide, we are able to see where we can put a stronger focus on health and racial equity in the action steps we develop to meet accreditation standards and ensure that this is a key element of accreditation.
Good. I like that. I mean, that's one of the ways you can make sure that health equity, advancing health equity is truly foundational to your work because you build it into accreditation processes. Excellent. So lastly, let's talk about how you all are using the Health Equity Guide to build a health equity movement in the communities that you serve.
Yeah, thanks. Again, within our health and racial equity team, we have a community connections work group. We are in the process of developing a guide for community engagement that centers health and racial equity. HIP's Health Equity Guide is informing how we implement our community engagement across Public Health Madison-Dane County. Specifically, we are using the guide to inform our 3 strategic practices of how we share power with communities, build community alliances, and engage in movements.
Yeah, there's that word again, power, and that power has to be shared. So, and how is the health department supporting your partners as your partners are working to advance health equity?
Yes. Some of the actions of how we are supporting our community partners include providing evaluation assistance and education so our partners have access to the tools they need to demonstrate the value of their work, so they may leverage this data for funding opportunities, for example. We are also supporting our community partners with grant writing, so they are competitive with organizations who have paid grant writers and can sustain the important work that they're doing. And we're also co-writing data briefs with our partners to make sure data is leveraged to tell a story led by community. And I know that you're going to be sharing examples of how our Black men's and Black women's data briefs show this as an example.
Yeah, we'll definitely be actually sharing that with our audience with all of the resources that we're going to have tomorrow. So yeah, guys, you could need to look for those data briefs. So I love these examples. I mean, these are really concrete examples of how a health department can support its partners and support the community as you all work together to advance health equity. So thank you so much, Elise. Stick around. Got questions for you too. So Justin, can you share what some of our audience has been saying about building a health equity movement within their organization or community?
Sure thing. It's a bit of a challenge because we have so much great stuff coming in. Sometimes we ask for attendee feedback and there's kind of crickets, but you guys are fantastic. So I'm just going to echo one of the responses from a doctoral student, and I totally am missing her name here, but she just said she's really inspired by seeing all this. She's hoping to work in the field of health equity and really inspired to see all this work going on in communities around the country. But just to highlight a few examples, it sounds like using health equity in the county health department's strategic plan at the local level has been an example. Also using it as someone said from a community foundation perspective, including racial equity in their grant guidelines. I thought that was a really great example. Empowering a team of residents who are affected by poor health outcomes to advocate for policy change. So really that community resident engagement. So I think there's so much good stuff here that, Erica, maybe we can capture this feedback and really share kind of like a list of these as a handout afterwards too. I think would be a great idea because there's really some good stuff.
That's great. And I love the fact that I'm hearing things from obviously different sectors outside of public health. So that is awesome. And for any grad student that's out there, thank you so much for tuning in to this webinar, because again, I think this is a great part of your training. I'm a little biased. I work for County Health Rankings and Roadmaps, but I think we can help plant those seeds. So thank you very much for tuning in. And I'm interested also in hearing what the rest of you all think about this webinar. So we're actually going to chat, Justin's going to chat a link to our evaluation. And if you could pull the evaluation up, and then in a moment after the webinar is over, take a few moments to fill out the evaluation after the webinar is over. So thanks, Justin, for chatting that out. And now let's see what some of you have been asking questions about. So what are some of the questions that have popped up, Justin?
Sure thing. And again, no no challenge to get a good amount of feedback here. So I'm gonna, I have some really good questions that were submitted prior to the webinar as part of the registration that are actually being echoed by some of the live questions coming in. So the first one seems basic, but I know it's a challenging one to answer. Is that someone expressed that I'm feeling so overwhelmed by the work we need to do. So how do I get started?
What you think that might be good for Jonathan? What do you think, Justin?
Yeah, I think Jonathan might, be good to take a stab at this.
Yeah, Leah, you may have some things to say as well. I think it's easy to feel overwhelmed, but doing nothing doesn't help with that. And so I think really it's about taking small steps. You know, look at the strategic practices, decide on one thing you want to do. You can't do all 15, but start in one place. It'll lead to other work. You can just launch small experiments, risk-taking experiments, see how those go, get feedback, try another little experiment, build on that. It takes leadership from all of us. We can't just wait for the leaders of our department to do this. We need to become leaders, all of us ourselves. And so just trying small things and changing things within our department, things will flow from there.
Thanks.
Yeah, I would echo some of Jonathan's thoughts. My colleague Jordan always says, operate within the sphere of your influence. So ask yourself, what can you do within wherever you're situated, however you're situated, within your organization, but also outside, maybe in your faith community or in your other things that you participate in. And then begin by building support. So talking with people within your organization, sharing your perspective and your passion. Who are key supporters that you would need? And then again, not to borrow from Gare, but begin to normalize. One of the things we did early on that's captured on the Health Equity Guide is that we began to normalize conversations using information education sessions where we could learn together. So trainings and professional development opportunities. So just begin those conversations and building those relationships.
Thank you both. And I think you both kind of just started to touch on another question I wanted to bring up that is definitely related. And it kind of states that achieving that health equity and through social justice is very much kind of a long-term game as we think about it. So how do we kind of plan this movement with some short-term wins, and what are some specific examples of those?
Leah, you want to go first? You want me to?
Go ahead.
Okay. Yeah, I mean, so it is very much of a long-term game, and we need to be in it for the long term and take care of ourselves so that we do end up able to maintain it. But you know, I think that we've done small projects with community organizing groups where we analyze data from a public health perspective and give them a public health frame on a campaign they're running, which is a small local campaign, like on a minimum wage bill or on a housing related bill to increase the amount of affordable housing or to prevent displacement, on a transportation project that's being planned in their neighborhoods. I think just engage with the community on a project like that. Often that leads to small wins, policy wins at a local level. And if you do a few of those in different neighborhoods, they build on themselves. You can start doing a little bit of work statewide with other groups working on similar kinds of issues. And that takes a life of its own and does build to that long-term work. So I think getting involved in campaigns and social justice campaigns is a great way to get some of those short-term wins.
Yeah, I would echo again, very similar is sometimes the short-term wins are again, those relationships. So showing up at the tables that are already set by folks and having some one-on-ones and really communicating what your organization has to offer and that you value their work and that you understand, in particular as a public health department, that they're helping us do our job, which is assuring the health of the community. And so again, structuring those movements, sometimes those wins look like relationships that you haven't had in the past. So that's what I would say.
Yeah, those are really great responses, guys. Thanks. I think that So I had a good question that came in live during the webinar about, would you recommend this health equity guide to be used by groups other than local health departments? Because I know we've taken kind of the lens of the local health department, and we here at County Health Rankings and Roadmaps very much kind of advocate for this multi-sector work, and how addressing community health is very much the work of everyone in the community. So, how can other sectors, if you will, use this resource?
Yeah, I mean, we wanted to create a guide that was specific for local health departments because that's an audience we work with a lot. But we think that almost all of the strategic practices are translatable to other groups, whether it's other government agencies or state level government agencies, but also folks working in the community can implement many of these things as well, and or put pressure on their local health department to implement these things. So we can all be approaching our local health department and asking them, why aren't they doing some of this work? Why aren't they working with community organizing groups? Why aren't they working with other government agencies? And so I think a lot of this, a lot of what we're recommending is broadly useful, and also can be used by folks to really put pressure on local health departments to do this work in a meaningful way.
And Jonathan, can I maybe put you on the spot with that last comment a bit, because you mentioned community organizing groups, and maybe if you could just kind of help define that best for some folks, if they have it, maybe they're thinking it has a different definition of what it looks like in their community.
Yeah, I mean, we have a very specific idea about what we mean. We're not talking about just any community-based organization. By community organizing group, we mean a group that's generally got a base that it's accountable to. Often it's a membership. They bring those folks together to solve problems that those folks identify. They mobilize resources together. They develop and implement strategies that reach their collective goals. Those groups develop civic agency among individuals, and they really work to build power in communities so that folks have more control over their lives and environments. So it's not just any group. It's really one of these, other people call them base building groups or grassroots groups. We call them community organizing groups.
Yeah,
thanks for asking that.
Yeah, no, that's really helpful, and an important distinction, I think. So maybe I had another question that came up both before and during this webinar, and really thinking about how to address health equity best in rural America, and especially in conservative leaning counties. And I know that's a tough one.
Hey guys, I really would love for you to answer this question, but do you mind if I share a resource from County Health Rankings and Roadmaps first? And because that's really a good question. And the majority of the communities or counties in our country are actually rural. So I can understand why that question would pop up. I do want to tell you about a resource that County Health Rankings and Roadmaps has called What Works for Health Strategies to Improve Rural Health. And you can find that on our website under Take Action to Improve Health. And also, again, that report is like one of the reports that actually has some strategies that have an evidence rating that you can sort through to see what might be appropriate for your community. And you also want to take into account what is already going on in your community and whether or not you have the capacity to implement any of those strategies. And then I also want to encourage you to look at the webinar about a living wage. And that was one of the webinars that I suggested that you all look at, and it's featuring the Monadnock community that's in New Hampshire. So in that webinar, they talked about a campaign that they created to have a living wage for everyone in their community. And they actually got a lot of political support for this. I know oftentimes in rural communities, people are concerned that sometimes they can't have that political will. So check out that webinar that's on our resource sheet that we're going to be handing out tomorrow. And I do want to kick this to Jonathan and Leah and see if there's anything you want to add to that as well.
Yeah, I would love to. We definitely see rural areas that being super hard hit, and low-income rural folks, both white and people of color, are facing huge health inequities. One of the strategic practices that I think is particularly relevant in this case is under the champion transformative change piece, and what we call it here is changing the conversation. It's changing the narrative about what creates health. If we think about the narrative in our rural communities these days and why our rural economies are such a mess, we basically see blame. The narrative is that immigrants are causing this, or urban folks, especially low-income Black folks in urban areas, are causing the rural problems. People living on the coasts are responsible for, the heartland problems. We blame Mexico, we blame China, we blame government wholesale, right? But I think we need to change that conversation. That's not really why our rural economies are a mess. We need to help people understand that, and we've got we've got a lot of economic policies that are not supporting rural communities. We've got drug companies that have been able to feed opioids to rural communities. Those are the policies that are really affecting people's health in rural areas. And so we need to change the narrative and stop scapegoating folks and get to real solutions, building these bridges between the rural folks and the low-income urban folks, so that those groups come together to have some power that will benefit all of them together. Sorry, that was a lot.
No, Jonathan, that was fantastic. A lot of fantastic points, and I think you really kind of drove the kind of shifting of a lens in which to perceive these problems, and I think that's really important. And I want to throw out just one more pretty challenging question to both Jonathan and Leah. We're talking a lot about race in both urban and rural settings, and how do we even begin to move the needle on racism, or how do we have authentic conversations about race in policy spaces, and to kind of bring this together with a live question that came in internally within an organization? How do you start to embrace racial equity first within an organization?
All you, Leah.
Sure. I think these two questions build on each other. I'm happy the discussion that you began, Jonathan, around the narrative, because I think if we're not careful, we can start to use the word rural as a proxy for white and urban, or low income, urban as a proxy for Black. And so I think one of the things that we need to do is to remind ourselves that, of course, there are in rural and in urban areas a number of different races of people. And then I think that just builds in those pieces about normalizing conversations. We're not going to move the needle on racism if we can't talk about it. And so really challenging ourselves to become practiced in having conversations around race and inviting people into the conversations. And that includes creating brave spaces. Like, we need to not assume how something is going to be felt or heard, but put questions out there, post challenging questions. I mean, I know that the Human Impact Partners Health Equity Awaken Fellowship taught me that they're called mashed potato questions. That's what I've learned recently. It's like, what's that question that you can ask? Like, what's your definition of racism? Ask a challenging question. Begin these conversations with individuals, because again, if we feel discomfort in talking about it, then we'll never be able to move the needle on it, and we'll never be able to call it out, in particular in the subtle and systemic ways that it's built into our systems. And so developing a comfort through normalizing conversations and creating brave spaces and asking challenging questions.
Leah, I think that's fantastic, actionable recommendations and advice for everyone. And I know we have so many other great questions and comments coming in, but I want to toss it back to Erica, because we're just about at time, and I want to see how fast she can close out a webinar.
You are so mean. Okay, well, obviously this is such a rich discussion, and thank you guys for sticking around to listen to Leah and Jonathan answer some of your questions. But obviously there's a lot more that we can discuss. So I want to invite you to come back and join us a week from today on January 30th from 3 to 4 Eastern, where we'll have like a post webinar discussion group. And this is going to be different than a webinar because actually it's a facilitated interactive discussion where you will actually be able to share a lot of things that you've probably been chatting in. So it's going to be a face-to-face conversation. I mean, video conferencing is definitely recommended, but if you're camera shy, you can call in as well. But please do plan to take part of that discussion. Justin is going to chat out the registration link for that. And it's going to be facilitated by our partners, Active Living by Design, and Joanne Lee will be leading that discussion. Now, Jonathan, I understand you're going to be there. So, guys, if you wanted to talk a little bit more about that health equity guide with Jonathan, he's going to be joining us that on next Tuesday. So please do stay connected with us, folks. We have a presence on social media, on Facebook, and follow us on Twitter. You see our Twitter handle. And sign up for our newsletters. This is the best way for you to find more information about our webinars and about our new tools and reports that we'll be promoting over the course of the next year. And then lastly, I want to tell you about our 2018 rankings. Justin, can you believe the rankings are right around the corner?
I cannot.
So I'm excited. I know you are too. And we want our communities to be just as excited and ready to actually take action. So we want you just to be prepared to take advantage of all the attention and excitement that comes with the release. So we're actually going to have a webinar on February 27th to do exactly that, get you all prepared. On this webinar, we're going to be talking about the new features and resources in the 2018 County Health Rankings, including a focus on health equity, guys. We'll have tips and to give you help you to better understand your county's data. And then we'll also talk about how you can leverage the County Health Rankings as an opportunity to spur action in your community. This is how you're going to start building your movement for health equity. Remember, I told you earlier, start with the data and see where the data leads you. So look for the registration link that's going to be posted on our website in a couple of days for this particular webinar, and be sure to register for it. So with that, I just want to give a huge thanks to Jonathan and Leah for sharing their time, expertise, and resources and stories. Thank you to all of our participants who participated in the webinar today, particularly those who come month after month to hear what we have to say. Thank you so much for your support every month with our webinars. Thank you, Justin, as always. You know how much I love partnering with you on webinars, so thank you so much. And I look forward to seeing everybody next month. Have a good afternoon.